Hello, this is Dr. Stanley Lang, and welcome to this broadcast. This is a continuation of a series on how to use a holistic health approach or a whole person health approach to help to control or prevent diabetes. And this is a diagram of the model that I've been showing that illustrates the integration of body, mind, and spirit in terms of a whole person approach to health, and basically ask the question, how can I use these different parts of me to be more healthy, and in particular to avoid or to treat diabetes. Now, you know that I've many times talked to you about the role of exercise, and today I want to focus on how cardiovascular exercise plays a role in diabetic prevention and management. So there are multiple different levels of how cardiovascular exercise is useful in treating or preventing diabetes. And so cardiovascular exercise includes the umbrella, or basically is an umbrella term that includes what we often call aerobics or aerobic exercise, but it includes other variations of that theme with the purpose of helping the entire cardiovascular system to become more healthy, with the focus on increasing the work of the cardiovascular system somehow and increasing the fitness of the cardiovascular system, meaning in particular the fitness of the heart. So you have to, in other words, you have to really work the heart a lot harder than just sitting around to get the benefit. So how can you best use cardiovascular exercise to achieve the goal of improving your body's chemistry? There are basically two variations on cardiovascular exercise that people are somewhat familiar with. The first one is traditional aerobics. This was popularized by Dr. Kenneth Cooper in the 1970s and has been used in a variety of different ways to come up with dance routines, with water exercise programs, with jogging. So it applies to a lot of different types of exercise, but the general pattern is that you're continuously exercising 20 to 30 or more minutes at about the same intensity most of the time. So the goal is to stay within this range of between 70 and 80 or 85% of your maximum heart rate. And this produces a whole lot of very positive changes in the body. Research years ago showed that men who exercised 5 days a week, that's 5 days a week versus men that didn't exercise at all, decreased their incidence of heart attacks by about 44%. Now that's a huge decrease in the risk of heart disease just by one activity, and that's daily vigorous exercise. Now, since the popularization of aerobics, more research has been done that shows that a second type of exercise, which goes under the term interval exercise, and there are a lot of variations on this, is actually much more effective because it stimulates the heart to be even more fit. It stimulates the heart to be fit in different settings, that is, at higher intensity exercise, and it also has a much more powerful effect on lung function, and it builds muscle better. So this type of exercise, called interval exercise, has been popularized by a couple of different doctors. Blocking on his name now, Dr. L. Sears, who popularized the system called the PACE program. And this is, I think, the most effective version of this type of exercise where you literally push yourself to maximum exertion over a period of 30 to 90 seconds, and then you let your body completely recover, and then you repeat that sequence multiple times in a row. And the goal is to be at this peak exercise at least 12 minutes during a typical workout of about 30 minutes. Another doctor who's popularized a variation of this theme is Dr. Mercola, and his program is called Peak 8. Now, there are other variations on this theme, but the basic approach here is that you really push yourself to maximum and then allow the body to recover. Then you push yourself to maximum again. And in this program, you're pushing yourself past the amount of energy that the body can produce by just utilizing the oxygen pathways, which we call aerobic. and you're pushing the body into anaerobic or without oxygen exercise. Now, both of these can be very helpful in helping to control diabetes. They probably are going to evolve more into a combination of the two as the best strategy. There's differences in opinion, which I'm not going to review right now. But like I talked about with low glycemic eating, cardiovascular exercise is the other physical foundation stone to changing your body's chemistry, to either helping you to reverse diabetes or to prevent diabetes. One of these two types of exercise you need to be committed to if you want to be effective in changing your body's chemistry and in changing its tendency to be diabetic or to reverse diabetes. Now, in other videos, I'll go into more detail about why you might choose one exercise program versus the other, but one of these two you need to do, and you need to do several times a week. If you're doing the PACE-like program that Dr. Sears teaches, I recommend doing that 4 days a week. If you're doing traditional aerobics, I recommend doing that 6 days a week. So we can get into this in more detail, but my encouragement to you is to make it a weekly habit to do effective cardiovascular exercise if you have a desire to change your body's chemistry. In terms of this approach of body, mind, spirit, health, you can't ignore the body. You can't get to where you want to be with your body by just attending to emotional and spiritual issues, as important as they are. We are physical beings. We have a spiritual and an emotional component, but we have to pay attention to the basic chemistry of our body. So you must make a commitment to regular exercise if you want to be healthy. I wish you well. God bless and have a great day.